Hello, everyone. Welcome to SCube TV Global. I'm your host, Rajni Bharara. And today on the show, I have with me a very special guest. His name is Dr. Dayanand Adi. And Dr. Dayanand Adi has an exceptional knowledge in the areas of Ayurvedic consultation, pharmacy, and hospital management. He is one of the pioneers in developing customized Ayurveda database software. And currently, he's working as a professor of Kaya Chitta department at Karavali Ayurvedic Medical College and Hospital, Mangalore. Today on the show, we are going to speak with him about varicose veins. But before we start the show and speak with him and discuss with him about varicose veins, we would like to welcome him to SQTV Global. Hello, Dr. Dayanand Adi. Welcome to SQTV Global.
Thank you.
So, Doctor, like I've introduced you, I've given a bit of your introduction to our audiences. So now I would like to ask you if you yourself can, talk about your journey, and if you can, give your introduction a bit to the audiences.
Thank you. As you know, my name is Dr. Dayanand Adi. Basically, we are from agriculture family. I thought of doing the BSc Agri, but somehow I got into this course, Ayurveda. So after my journey of 5.5 years, I've been to Kerala, where I was trying with the Kerala tradition of treatments for about 3 years. My guru, Sri Ravindranath. And then after that, I joined one more traditional Vishavaidya, that's who treats toxic things or the toxicology. There I was there for a few months where I could acquire some knowledge about toxic insect bite and snake bite. He used to treat snake bite too with Ayurvedic medicines.
Wow.
And after that, I started my journey as my clinic at Kundapur in Udupi district. And one fine day, I thought of doing my post-graduation and joined my post-graduation. That's the journey which is behind me.
Okay, and now you're currently working as a professor of Kaya Chikitsa. If you can also please talk about that.
Okay. Right now, I'm head of the department in Kaya Chikitsa. That's we can compare with the general medicine in the contemporary science. That's a college called Karavali Ayurveda College. It's in nearby Mangalore. And I'm an advisor to Dr. World's varicose vein treatment formulations, as well as the database, as well as the marketing and other things. And I've been associated with Sri Ranga Ayurveda Chikitsa Mandira in Mysore, where we're doing some clinical trials and cancer research through Ayurveda.
Okay. I mean, Ayurveda is really getting into a lot of things now, because recently there was a discussion, allopathy versus Ayurveda. So we actually would like to talk to you about that, but let's keep that topic for another day. But today, like I said, we'd like to talk to you about varicose veins. So, doctor, firstly, I would like to ask from you, and if you can please talk about what exactly is varicose veins, in a simpler language, if to the audiences, to the general people who don't understand the medical language. So in general and easy language, if you can please explain what exactly is varicose veins.
It's very simple that we see the veins, like most of us know what is veins. Veins is something which we get IV fluid, especially when we are hospitalized. So that is veins. And deeper ones, once we feel the pulsating, that is the artery. So normally when a person sees them, some of the people, they can visualize the veins. But if it is little bit more swollen up, whatever the person sees normally, that condition is also called varicose vein. And if it is twisted around as a triangulated, that condition where the veins are bulged up and twisted, where it doesn't have the normal shape and structure, that is varicose vein. It basically happens because heart we have where the blood is pumped easily throughout the body. But from the legs, the blood has to come back. Like to get water from the well, we have the pump to pump in very easily. But we have a different mechanism. The heart is there in the upper part of the body, but we don't have something pumping mechanism in the lower. So for that, there is a modification in the veins where there will be cup-like structures, which are called valves. So they help the blood to come up and that doesn't allow the blood to go back. So the mechanism fails there, then it will lead to the heaviness or accumulation of blood in the walls, and that will lead to the backflow. That will lead to the heaviness of the legs, swelling, cramps, or feeling of fatigueness in the evening after standing for a long period. This normally happens of venous pump, what we say. The blood coming back to the heart is because of our calf muscle acts like a pumping mechanism and our respiration. When we respire, our diaphragm moves up and down, where it makes like a suction pump in our tummy. So we are not aware of this because it's happening naturally. Most of us not aware of that. If you are obese, if you are in pregnancy condition, if you have any fluid accumulation, if you are suffering with the gastritis, then you have a pressure which is created in your tummy that will avoid the incoming blood because your tummy doesn't move up and down properly.
Mhm.
If you're a person who is standing for a long period, like most of our jobs is standing nowadays, whichever the
Mhm.
example you can take, police, security,
Yeah.
teachers, uh, even the sales girls, petrol bunk, wherever the area you take, it's more standing rather than sitting job. So continuously, if you're standing and you doesn't move properly, that will lead to the heavy pressure in the venous walls. Gradually, that will lead to the bulging. Like the veins will lose the elasticity. That's how they pull the upper part, then it becomes like a twisted, a triangulated like feeling.
Mhm.
That's how the venous return is reduced, and that's how the person will get into the varicose vein issues.
Okay, okay, got it, got it. So, doctor, also, you have explained it quite, in such a simple manner, in such a beautiful manner, what exactly is varicose veins. But now, coming to my next question, so what kind of people can get this condition?
Poor is lazy,
Okay.
basically, and as an occupational hazard also, which I was mentioning, somebody who is standing for a long period, sales girls or salesperson or doctors or nurses or somebody is in the medical shop, somebody who is teaching profession, conductors, because continuous standing, what happens is the circulation hampers in the legs. There
Mhm.
will be a lot of pressure over the veins too. The return will not happen because we need to move around. Because standing is
Mhm.
just, we are just lifting one leg and other leg just moving there. That is not happening.
Mhm.
Only the calf muscles has to move. That happens only when you are moving.
Okay.
But pumping will happen because of that. So failure in that mechanism, that's the one thing. The other one is the lifestyle because our food habits and the way we live, we don't exercise properly. So we don't have the proper drainage system, which is like a cleansing, which happens with micro channels. And
Mhm.
most of us are constipated, maybe because we are using the Western commodes where we don't evacuate properly, or our food style, or we sleep immediately after a dinner. We don't have much time. So the food will not get digested properly. It is not evacuated. That will create a pressure in your tummy. That will also create a pressure over your veins, which is coming from the legs. That will lead to the varicose vein.
Okay, okay. So, and also, what are the symptoms of varicose veins? I mean, also, is there any particular age, attached to this condition? Like, people from this age to this age can get, or younger people cannot get this, or older people can get this. If you can also please talk about that.
Basically, statistics says that elderly, because as
Okay.
we get aged, our muscles relaxes and this venous wall elasticity also get reduced. That's how it goes on. But
Mm.
nowadays, as I told, it has become an occupational hazards. We can see with the people or the young generation within 20 also getting this problem. That too, they are getting the problem and operated, and once again, it is leading to some other complications. That is very
Okay.
pathetic. That is very pathetic to say that because
Mhm.
veins are very important part of us. It's not just removing them or blocking them.
Mhm. Mhm.
So this happens to a younger person. Think of his whole journey. What happens
Yeah.
next? So this is something very becoming common nowadays because of our occupation, and lifestyle. That's the other
Yeah, and
thing.
also because I think because of the lockdown too, right? As the lockdown actually made our lives so sedentary, and everyone became so lazy, and yeah, I think that could
That's
also be a
an
reason.
added, yeah, yeah, that's added factor, especially I can say to the IT sector people, where at
Yeah.
least you have moved out of house and at least they have moved here and there in the office, but now they're stagnated.
Yeah.
Some of my friends also they were saying that it was better when they're going to the office because
Yeah.
they have that aspiration time in between, that
Hmm.
work between house and home office. But now you're in the house means you're available. So
Hmm.
you need to sit. So once you sit
Yeah.
sedentary, then you don't properly respire, you don't move, then automatically there are a lot of chances of getting the varicose vein.
Hmm. Hmm. Okay. And what are the symptoms of varicose veins?
Basically, it starts with feeling of heaviness,
Okay.
feeling of tightness, which we feel that because of tiredness and other thing which has happened. Gradually,
Hmm.
it turns into a form where it starts aching up. That if you stand for a period of 2 hours, 3 hours, then you start getting the ache and maybe a pulling type of pain. And then it can lead to the other feeling of like a burning sensation, like a hot feeling in the feet or in the calf. And then
Hmm.
gradually it will turn to the visibility of the veins. The initial stage, which we say that the spider veins, like a cobweb, it appears. It will be a color of reddish and bluish color, a very micro, thin vessels. We can see that. If you neglect that, then gradually it will lead to the varicose vein, which we called as varicose vein stages, which will lead to another further. If it is not treated, that will lead to the hyperpigmentation, where you get the blackish discoloration of your leg and other things. There will be a
Hmm.
if you don't treat that also, that will lead to the ulcer. Ulcer and wound, there is a difference. Ulcer is naturally which is happening inside. Wound is something
Hmm.
because of injury.
Yeah. Yeah.
Because the veins are not carrying the bad or the impure blood out, and it stays in the legs. Because of the backward pressure, you feel the heaviness. Because of backward
Hmm.
pressure, you feel the stagnation, which is leading to the heaviness of the legs.
Yeah.
And once the blood stays for a long period, the blood want to get purified. That try to find a route through the skin. That's how it
Okay.
leads to blackish discoloration of the skin. And once the cells are not getting a good oxygen and nutrition, they die. That's how it converts into an ulcer.
Okay. Okay.
If it is not treated properly, then the amputation is the solution. So the person can lose either toe or ankle or feet or the whole leg, possibly.
So okay. So which converts into a diabetic foot.
Not diabetic foot, ulcer which doesn't heal so properly. So they try with
Okay.
skin grafting and other methods. But here is you don't supply proper nutrition and you're asking the body to grow. It doesn't.
Hmm.
So the wound will not heal because it's not getting a good oxygen supply,
Hmm.
not getting a good blood. It's only the impure blood which is staying there. So our aim has to be to improve the circulation. Then the healing will happen virtually.
Hmm. Okay.
Naturally, it will happen. Otherwise, it won't. If you try to heal the wound will not get healed up.
Okay, okay. So, doctor, I don't know. I mean, I'm getting a bit off topic, but still, I would like to, ask this question. It's a very common and general question. So, sometimes when we stand for a long period of time, or we sit for a long period of time, or even we, in the Indian posture, with cross leg, in the meditation posture, when we sit. So, when we sit for a longer period of time, sometimes it happens that, I mean, one leg of ours, is in
Numbness.
yeah, numbness. And also I think in general language, in mango people's language, we call it a leg, one leg has slept, so it's sleeping, yeah, it's sleeping, or it's just that. So at that time when we feel that numbness and that sensation of because we want it to go away, and that tingling thing, so is there a way to get it over with as soon?
It's only you need to start move the fingers a little bit slowly and then the ankle and then it has to come. It's basically circulation impairment. But it
Okay.
happens mostly in the people who are anemic.
Okay.
And when the quality of blood where the hemoglobin is not so good, it's easy.
Mhm.
because once again the oxygen is not supplied, good blood supply is not happening. And the secondary is that people who are prone to varicose vein because of hereditary factor, because of smoking, because of obesity, whatever the reason. So that is something which happens. So if it is anemia, you need to treat that. If it is varicose vein, you need to treat that. Naturally, it happens because of the posture. If you sit for a long period, which you are not used to, then it goes by itself. Only thing you enjoy that process for a while, that your leg is sleeping for a time. But you start moving the toes, then it will help you out.
Okay, but doctor, if so, I mean, a person who is getting this condition or getting this problem, very frequently. So, can that thing, something that might seem a very basic or very common to you, might take a bigger form or might take a bigger picture or problem in future? Can that happen?
It can happen, definitely. As I mentioned, there are two major causes which you can see, whether your hemoglobin percentage is less, then you have other problems like giddiness, your heart rate goes up, you don't have a proper taste, hair fall, and there will be very sensitive to the loud noises. So then when you treat that anemia condition. If not, then it's varicose vein that has to be treated. But basically, it's an alarm. Once in a while it happens, that can naturally happen. But if it's repeatedly happening, then you need to take concern before it getting into something else.
Okay. So now, doctor, I would like to know about the varicose vein oil, which has been made by Dr. Ural. If you can please talk about that.
Yeah. Dr. Ural, he stays in Sringeri in Karnataka. He came up with a combination. It's called Amrut varicose vein syrup and the oil and the tablet together. So it's a unique combination which helps to improve the circulation. But when you apply the oil and you do the gentle massage, but we need to do it in an opposite way. That means we need to start from the toes and then gently move towards the upward, because that's how the blood is coming back to the heart. So we need to enhance that. So that's how it helps to improve the circulation by the movement. But the contents in the oil, they try to improve the circulation within the skin so that the stasis can be reduced. That means the stagnation of blood can be reduced. They moist the skin so that the ulcer will not happen. And the internal medications, and even you use it for the wound also, the same oil, that's also for the healing. And the internal medications which you are giving, they are easy to mention that they're like, if I use the Ayurveda terms, it may be difficult. So I will try to use the contemporary words. It is an antioxidant where it reduces the oxidation stress in the cells, improves the circulation. It's a blood thinner. It stimulates the venous wall to get the strengthened back so that the functions are much better. Here, the medicines will not act much. Medicines has to stimulate the normal process. Like if you have a fever, the medicine will help you to control your thermal center in the brain and everything. But here, it has to help the venous walls to get the normalcy. Then only it will happen. So this combination will have this method of treating the varicose vein, where it is a blood purifier, antioxidant, improve the circulation, and the medicines have proven that when there is a wound, they help to form the new vessels, new blood vessels, so that the growth factor is happening there. And we could see very chronic stages also getting healed. We have the images which you can look at that. Within a period of 6 months or 1 year, we are getting back the normalcy of the varicose vein or the wound or the hyperpigmentation. But each person is individual. We can't claim that we cure it 100% because of the occupation, because of the age, because of the social factor. Each one has taken time much. But in our experience, we are seeing that minimum, if a person is taking the medicines for a period of 3 months, they're able to appreciate the changes much more easily. They don't have the fatigueness, they don't have the swelling, the venous bulge is coming down, the pigmentation is coming down, the ulcer is coming down to a normal skin. So we could able to see the changes. But the period of taking the medicines may depend upon up to 1.5 years also.
Okay. So, guys, we are showing you the pictures of the oil. After the oil has been used, the before and after pictures of the oil that has been made by Dr. Ural. The name of the oil is
Ural's Ayurveda varicose vein kit. It's a combination of oil, tablet, and some herbal combinations, which are 100% safe Ayurvedic formulations, which are tested in the laboratory for the animal experimentation, as well as we are using since 15 plus years, so that there is no side effects. So that itself is a documentary. Says that clinical trials are much more easily done.
So, doctor, now I would like to know from you that who all can use this oil? Can anyone and everyone use this oil, or there is a specific criteria for that too?
If somebody was getting this particular symptom, then only it's better to get these medicines. Otherwise, if they feel that it's in the hereditary, if somebody is a long-standing, or if, as I mentioned, there are multiple jobs where you need to stand or sit for a long period, then it's better to do certain exercises, which we can share the video on that, and try to change your positions, move around after 1 hour standing or sitting. You need to squat and get up. You need to just relax your muscles, or you can use tight socks so that the pressure is maintained in your legs. And when you're sleeping, try to elevate the leg end. Maybe is lifting the cot itself is a better option, so that the venous blood flow, which happens much more naturally. Any oil you can apply: coconut oil, sesame oil, castor oil, whichever is there. Apply it at least once in 2 days, 3 days, so that the circulation is better, the fatigueness in the calf muscles is reduced, and other thing is try to breathe properly. Constipated, try to take the medicines which can relieve the constipation, because these are the associate factor which we neglect. Often we neglect, but when the whole disease manifests and we try to do this and that, everything, that doesn't work out with much well with that, because the time has led to the disease. So prevention is always better than cure, as it's told. So if your profession are like that, try to adopt proper breathing and exercises. It will not be like something yogic breathing like pranayama and other things. Generally, you can breathe completely with the abdomen in and out and chest abdomen in and out. These patterns, which you can see in Kapalbhati or Basrika, or normal proper inhaling and exhaling. And a set of exercises where which can strengthen the calf muscles, because as I told, these two are the main areas which you need to concentrate to avoid varicose vein. So if you can concentrate on these things, whatever we can do, that's always the better choice to prevent.
Great. So also, doctor, one more question to you is this medicine approved by the authorities?
Yeah, in Ayurveda, we have there are two sets. One is something which you get the approval from the government and you market it. Another is the doctor can themselves make the combination and it can be bring back to the market. But here we can't sell it as a normal medicine, but it has to be sold through our outlets only.
Okay.
Because it is the formulation, and it's a way which we need to deal with this because of the legal things. You can't get into the market as its open market, which we deal with during our studies. So we have the legally rights to produce the medicines too.
Okay, great. So, doctor, so also, there must be other medicines too for varicose veins. So now another interesting question is, how is this oil and this medicine different from other medicines which are available for varicose veins?
Exactly. Because always the competition and better things will be there.
Yeah.
There are formulations, but we are not getting much results in them. We can see that there are cream which you can apply where the pigmentation is reduced, or the bulging of the vein is some extent reduced. But there is always chance of reoccurrence. Even we don't say that our medicines are 100% curing them. We say that it's only 60%. 40% your exercise and lifestyle which you need to control. Even when we withdraw the medicines, the exercise and lifestyle things which are modified for you has to continue. Otherwise, you will get bad. Because it's just like we have a tagline called "We renovate without surgery." We do renovation. It is a renovation. It's not rebuilt.
Okay.
So there is always possibility that you need to take it. As you mentioned that the medicines which are available, few are good in blood purifying, few are good for the ulcers, few are good for the initial stage of varicose vein. But this formulation works from A to Z.
Mhm.
Whether you are in the initial stage of varicose vein or you are at the other verge where we have the varicose ulcer. So the same medication will work from A to Z. So this unique formulations is not such easily available in the market, which I can quote it on.
Okay. Okay, that's really amazing. With this, also if you can please talk about how long does the medicine take to, I think you already have mentioned that it might also take an year, but still, I would like to know that if you can again, talk about how long does the medicine takes to cure the problem, and what is the proper treatment involved in it?
Basically, treatment goes with the condition of the person. As well, there are different stages. There are like we can say the 5 stages, which is the one is the spider vein and the reticular vein, the second stage. These are very initial stages where we do a leech application. You might have heard the leech, which is when you go to the mountains and the rainy season, they suck the blood and that doesn't leave them. But we have the medicated, we use it for a medicinal value. They're not poisonous. They are the best anticoagulants which can leave into the bloodstream, make the blood thinner, so that whatever the blood is stagnated there, that moves easily. So you have the process of pushing that, and it sucks out so that the fresh blood can come in.
Okay.
And then the medications are given. And if it is in a third stage, like a varicose vein, just like somehow you give the blood donation, or you can say the when you are blood to someone, like that we have a veiny puncture, this procedure. This helps to reduce the venous tension because it removes the blood. When we remove the certain volume of blood, what happens is the body dilutes the blood naturally because it needs the volume. Otherwise, the heart has a problem to pump. So this dilution will make the blood thinner and the impure blood has gone, so that your blood becomes freshened. You have a fresh stream of liquid in the blood. So this reduces the burden. Oxidative stress are the antioxidants which are there in the blood, which is making the cells to suffer. That will get reduced. This is in the second and first stages. Later stages, if it is getting into the complete varicose vein, then we need to see which combinations of therapy has to be done. Along with that, if it has become discoloration or blackish discoloration, itching, or rashes which is coming up, there we need to pour some herbal decoctions on the leg, just like how we take a bath, like a baby bath, we can say that, with the towel, and then you take some vessel and pour on the area. So this helps to improve the circulation, along with the internal medications, what I'm talking about. So it's not a one remedy that has multiple benefits. It's a set of combinations of external therapies and the medicines and your lifestyle and your diet restrictions. So all together combination will create a healing environment in the body. Because when we're not, healing environment is very essential. To get a disease, we create an environment. For example, in a rainy season, automatically we see the green everywhere. Because that's the environment which is created. Summer, everything dry. So the process will happen naturally. Only thing is we need to create an environment, a favorable environment. These medicines are very effective in creating such a good environment in the body that the healing process will naturally happen. So this is the same thing which we carry to the ulcers. But in case of ulcers, we do a process called Panchakarma, internal detox, which is an in-house treatment where we ask the person to have some medicated ghee for a period of 5 to 7 days, and then we do oil massage and steaming the body, and then we give the purgation. So this whole process will make the vascularity better, your circulation better, your liver vessels, your vessels will get cleansed, bone marrow will cleanse, heart vessels will much more get better. So all these things together into the circulatory system. So this is which is in a chronic condition we need. Initially, we don't require all this, but as a process, I'm telling from the beginning to the end. So the whole thing has to be set up are made in such a way that the healing environment has to be created depending on the severity, age, and the occupation what they are doing.
Okay, got it, got it. So, doctor, with this also, one more question to you is: can you please share some example who it must have helped, and also, because you already have the images of before and after. So, if you can please give some examples of some of your patients who actually got properly cured, or who got better after using this varicose veins oil.
There are a lot of people who are referring, because we are not going into a big marketing as such. It's going to a word of mouth, people to people. It's going up because there are sufferers. There are no proper solutions for them. Either they get operated or they get some medication which doesn't help them. Even in spite of operation, which is coming back, that we can, as I mentioned, also the ulcers and other complications which is coming back. So this is something very unique way that the word of mouth spreading, which is helping us to get more patients also in the same way. And to take an example, recently I had one patient whom I told him to get admitted and do the treatments which were in the verge of getting ulcers. Unfortunately, he has only 15 days to get retirement from his job.
Okay.
We told him, I have only 15 days, let me go and come back. When he went for the job, it bursted into ulcers.
Okay.
It took almost 2 months to heal whole ulcers. But now he's quite happy. But if he had gone in the same condition to other alternative medicines or contemporary medicines, they would have done the amputation, they would have done the skin grafting, but now we could see the changes. It's so minute changes which are happening. The person feels much more happy from inside. And it's not only bothering him, his economy, the family, and his psychosomatic conditions, because he becomes a burden to the family.
Yeah.
So altogether, we can say that this is a comprehensive healthcare which is helping the people and the family and then the society. We are thinking in more terms of making this as a awareness cramp rather than the treatment. Because when you are aware of certain things, we can prevent it. Because to get into this, it's not 100%. As I told, we renovate. It's not getting back to the same. So we are collaborating with multiple NGOs, and we are doing the presentations in different schools, colleges, and for the public through the Rotary or Lions Club or any other NGOs who help ask us to do the camps. So we are making that awareness that our intention is to make that, to say that varicose vein should be eradicated, or there will be a stage where there will be no varicose vein. But if your lifestyle and certain exercises are the prevention which you follow them properly, we can say that.
Great. And I hope this interview helps you to spread the awareness about the oil and about your treatment that you're providing. So even we want this varicose vein to be vanished from people's life. So with this, one last question to you, doctor. So is this medicine completely Ayurvedic?
It is completely herbal. There is no much minerals into that, or we can say that they're safe. As I told, we are using it since for 15 years to the humans. It's not an experiment. So when you're using to the humans, then you can see that. But we have subjected these medicines to the lab also, where we see how it is acting, how it is helping out. We have seen that, and there is no toxicity as such. And to help the people to reach out, we have different branches also. In Karnataka, we have 10 branches in almost each district, so that the people can come out and take the benefit. In Hyderabad, we have one branch. In Matkal, we have one branch. In Pune, we have one branch. So that the people need not to come to one clinic. Let this be out to their doorstep, so that they can get benefited and they can be more aware. At least, this is a clinic which is helping them to cure, or them to better, or to prevent also.
Amazing. Yeah.
We are thankful for your channel to give an opportunity for us to express ourselves for the benefit of the society.
Definitely. Definitely, it's all the pleasure is all ours. So, doctor, before I let you go, would you say that it does not, and still, I mean, until now, it has no side effect to any patient?
Yes, we can say there is no side effects. Only thing is it can create little hyperacidity. That means if
Okay.
a person has an acid reflux, then they will get hyperacidity. Then we need to do the modifications in the medicines dose and other things, or we need to treat that hyperacidity first and then give this medicine. Apart from that, till now, frankly speaking, till today, there is no other thing. Tomorrow we need to see if happens.
Okay.
But since 15 years, nothing is there. That means it won't be.
Beautiful, amazing. So we are really hoping you all the best for it, and we really hope that, like I mentioned, that this interview also helps you. And thank you so much for coming to SQ TV Global and speaking with us. It was so lovely having you on the show, and thank you again.
Thank you.
All right, guys, that's it from SQ TV Global. Keep on watching and do subscribe to the channel.